So we often get asked, what's the difference between our surgical recovery using the ARP wave therapy versus a standard surgical recovery? One of the first things that I like to point out is that we can begin our recovery pretty much immediately after the surgery. The reason for that is with the ARP we have two fundamental settings. We have what we call the background setting, where there is no muscle work. There is a current going through there is a high level stimulus, but there's no muscle work going on. So while we're using the background wave, whatever surgical repair was done is completely safe. And since we're pushing that current through, we're helping to accelerate blood flow. We're causing the muscles that are in spasm to release a little bit to create more comfort for the patient. We're also, by essence of that blood flow, we're allowing things to heal in a more clean way. So once we get through this phase where we're using the background wave to create more comfort, create more range of motion for the patient, we can then move to the active recovery. And we do that at the doctor's discretion. Whenever the doctor says the client's ready to do active recovery, that's when we can begin. With our active recovery, we add in a secondary wave. This wave actually stimulates the muscle to a high level. Again, the difference between our stimulation and normal stimulation, normal E-stim is going to cause the muscle to go here. Our stimulation is asking the muscle to go here. So it's on an eccentric contraction, reinforcing the muscle's job in the body to act as a shock absorber, to absorb the shock that enters the body. Since we're able to strengthen this way, we don't have to have the person just sit still. We can actually apply our functional movement programs, which are one-of-a-kind exclusive ARP programs, to help recover strength, and not just specific strength around the joint structure that was repaired, but functional strength. So we can bypass several of the steps in a normal recovery and condense them to get the result that we're looking for. So to me, those are the two big things that are the big difference between our recovery from surgery and a normal recovery from surgery. And again, we can start that recovery pretty much an hour after surgery. If you want to find out more information, please go to RecoverFast.net.